this one today in particular is talking about incontinence treatment for women with some vaginal rejuvenation. We are born with a urinary tract and a sphincter at the very bottom of it that keeps everything in. So anything that is leaking at any point is incontinence. The stats, which are pretty eye-opening, 423 million people worldwide, again 13 million in the US, and more common in women than in men. Again, though, if you look at like stats on how many are actually treated, they're looking for things that don't involve medications, injections, and surgery potentially. Those three things that we talk about with regenerative treatments is it effective, is it safe, and are there alternatives that you can do?
No pain, no downtime, in office, no cut, no anesthesia.
Welcome to the RevMD podcast with me, your host, Dr. Debra Durst. I am a traditionally trained physician that now specializes in regenerative medicine with a focus on sexual wellness. And I have my host here with me today.
Hey guys, Faraday Golombieski. I am a board certified family nurse practitioner and I work alongside Dr. Durst at RevitalyzeMD.
So we do the podcast together and we have a practice. So we see each other all day long, all the time. And again, now this allows us to do some regenerative, comprehensive treatments that don't involve necessarily medications and surgeries, just science-based stuff that allows somebody a non-traditional option for treatment. And today we're going to talk about incontinence, which means leaking of urine, which isn't just a female issue. It can be men too. I know. So,
I had a male friend ask me about this the other day.
Yes. Yeah.
But typically it is my female friends that are
asking
first.
Yeah.
Well, because, babies and age. I mean, it happens to us a lot sooner, I think, than men.
Well, and different kinds too, like where they get a little more urge and we get stressed. So there's different kinds. But this one today in particular is talking about incontinence treatment for women with some vaginal rejuvenation. So we're going to talk about what incontinence is, what the stats, which are pretty eye-opening on incontinence and how many patients have it, what incontinence means, what the traditional treatments are, and what the recent updates for traditional treatments were. And then what do we do with regenerative treatments and how do we treat that? And today it'll be talking about a study with women and vaginal rejuvenation and improvement of incontinence. And then we will tell you what we're seeing in practice as well. So
that's right. So what is incontinence?
Yeah.
Right? The involuntary loss of urine.
Yes.
I mean, that's essentially kind of what the meat and potatoes of it.
Typically, we are born with a urinary tract and a sphincter at the very bottom of it that keeps everything in. So anything that is leaking at any point is incontinence and not working the way we want it to. And it can be stress where you sneeze, you cough, you get it.
You jump.
Yeah, it can be urge. There's a mix. There's an overflow. Your bladder's full and you're leaking. So
there's functional.
Yes, which are related to
anatomy.
Yeah, and or medical conditions.
Conditions,
for sure. Aging definitely plays a role. Perimenopause, menopause, childbirth, and the changes that happen in the GU system, the genital urinary tract, and in the vaginal region, which is where the urethra is for us. And again, women had a very short urethra versus men having a very long. And so I think that contributes as well to us having again, increased. It's definitely a gender preference for women. Absolutely. I don't know if I would consider it a preferred thing.
I was going to say, I don't know if I like the word preference.
Yes, but it definitely happens more commonly in women.
And they're
not preferred. But
not preferred, but it's more prevalent.
More prevalent,
for sure. In women.
Yes.
And then total 13 million people in the U.S. affected by?
Yeah, 423 million people worldwide. Again, 13 million in the U.S. And more common in women than in men. But older men, and it's more urge when they have it. So
423 million worldwide.
Yes.
That's a huge number.
And so again, though, if you look at like stats on how many are actually treated. So we did another podcast on incontinence that talks about this in more specifically, but there are some projects they did between 2005 and 2016, and essentially a couple of them that said 53% of women had incontinence, 30% moderate to severe, impacted daily life, and yet very few of them actually were receiving treatment. And surgical was 4.7, decreased to 2.3, starting about 2011. So people are not preferring surgery for it.
Yes.
But if you're talking about it, 2% are getting surgery for it, and sling was the most common. Everything else, was pretty consistent as far as Botox. They actually use Botox in the bladder wall. That was one of the recommended treatments for traditional medicine. And so that's a significant, treatment. That's injections. And so that's the incidence or the treatment percent with like injections didn't change, but the slings did go down. So less people wanting
there's also
surgery.
a lot of issues with the slings,
Yes.
which I'm sure has further decreased that number.
Yes. Well, and we look at that. So again, when you put a medical device into a patient and you implant, that does have to be FDA approved. So as you can see, FDA approval doesn't necessarily mean there aren't issues. So when we're talking about, is there safety long term? Is it effective long term? Well, here's one that, again, has been pulled out. There's mesh and slings that have had issues.
There have been lawsuits. They have had countless issues and have caused more issues in some women.
And so I think that people are pretty logical. And so, they're looking at stuff like that. And do they really want to undergo surgery because that's insurance covered? And
anytime you can prevent going under anesthesia and cutting into the body.
Yes.
Those should be the options first.
Yeah. And so they're looking for things that don't involve medications, injections, and surgery potentially. And so that's where it comes into, I will just say traditional treatment options did not include any regenerative treatments. And if you wanted to know more about what was recommended, that's where I'd refer you to the podcast on incontinence treatment. But basically now what we're talking about is there are some studies. So vaginal rejuvenation, laser vaginal rejuvenation isn't something that, the laser companies will promote in the US because of, again, legal implications and not a lot of studies on anything regenerative, because if there isn't somebody taking it to market, and again, with
and this
laser
is going to be
treatments,
something you hear on every podcast
Yes.
just about when we're talking about traditional versus non-traditional medicine.
And it's hard to get studies. So I would say that I was thinking about this as we were prepping for this podcast. You can basically look at medications and you can do a double-blinded randomized placebo control, right?
Yep.
How do you do that with a laser treatment? Like, how does one be blinded to the fact that they have warmth in a laser treatment or they don't?
True.
So you really cannot do randomized controlled studies for regenerative treatments such as this.
Because they know if they're getting treatment or not.
Yeah, nobody's going to consent to getting an hour treatment with a laser and just have a probe inside with no heat, and it's randomized and blinded, and they didn't get anything.
Yeah.
And likewise,
it's not like a pill. Everybody takes the same white pill. There's no taste difference, color difference, look difference,
Yes,
right? You don't know
correct.
what you got, what you did get.
No, this one is like going to a GYN, putting your feet in stirrups.
And did you get a pap or not get a pap?
Yeah. And just, for an hour treatment, and maybe or maybe not got it. And again, even for like O shots and PRP injections, same thing. So how do you actually blind for that and randomize and blind and them consent to it? So I think that sometimes we just have to look at these therapies again. Those three things that we talk about with regenerative treatments is it effective? Is it safe? And are there alternatives that you can do that are safe and effective? And so right now we're going to look at a study that was done for erbium laser vaginal rejuvenation, non-invasive. So these are in-office procedures with no pain and no downtime. And
no pain, no downtime, in office, no cut, no anesthesia. Just
correct. And so there is multiple laser companies that do that. We're going to look at a study that talks about erbium. Erbium typically is an ablative laser treatment. With the treatments that we're talking about, it is non-ablative, which just means it doesn't ablate the top surface of whatever you're doing. So if it's skin and you're doing an erbium, it can be ablative. If it's vaginal, it can be ablative. But treatments we're talking about are non-ablative, non-invasive, and are actually, again, developed protocols by the laser companies, depending on which one you're talking about. So this is an erbium non-ablative laser for mild to moderate mixed and stress incontinence, and whether it worked or not.
Yeah. So these are pretty mild procedures. They're comfortable. There's no downtime. You're in and out of office. I mean, they are really non-invasive when you think about the options of slings, right? Or pessaries, or, these other options that are out there for women. Or, in traditional medicine, what we hear even more is, well, wear a diaper or a pad. So these are treatments that are.
And we had that podcast as well.
And
Highly
that is,
recommended.
absolutely,
It's
which is because it's
traditional.
very
Yeah.
frustrating that
Yeah.
as a woman, that is your response given to you when you say I'm leaking urine. So these are very easy procedures that you're in the office and out within an hour.
Yes. So I would say even further, like if you're looking at the very practical aspects of this, if you're talking about an insurance based, what does it cover? You got to go through all the testing. You have to go to the office. You're talking about multiple office trips, maybe to the primary, referral to urologist, waiting in the office, getting it through, submitting to insurance, all the work, which is almost a full-time job just for that as a patient, not alone, let alone the office in the medical office, which again, you can do studies on how much time it takes for them to deal with
Yes.
insurance claims. But then also, does it work? You're going into a pre-op area, you're getting anesthesia, you're recovering. I mean, you're talking about a very extensive time versus, and we do this in the office, so we can literally speak to the fact that we do this on a daily basis with women. They come in, they could actually meet with a provider. It's always, they're going to have to meet with a provider. It's going to be, again, somebody that's evaluating them medically, deciding whether they can do it, but they can proceed with the treatments that day. And it's not
Absolutely.
painful, and there is no downtime, and it is effective. And that's what we're going to talk about, is that the safety and efficacy is there. And so this was a study.
And this is a
again,
study just for that.
just for that erbium laser, which is one of the lasers we use. And again, Fatona is one of the companies we use. We also do an RF, which is an erbium. There are microneedling, devices you can use. This one in particular is talking about our Fatona erbium non-ablative treatment. It was in 2022 in a Laser Science journal, and studied 132 women that basically had, the average age was 50 years old, and deliveries, they either had in between 0 and 4, but it was like 1.9, so almost 2 vaginal deliveries, and they had 2 sessions. We usually recommend it in a series of 3. These were 2, 4 to
And they
6
were
weeks
4 to
apart.
6 weeks apart.
Yeah. And the follow-ups were 3 and 18 months, and the results were pretty darn good. And so the other thing I would ask is, there is actually an incontinence survey that you can do on these patients that we really didn't know until we go to the laser conferences and we learn the science. And Fatona is an amazing company with, again, a lot of science-based protocol development, physicians that are scientists, and we're physicians that are like, we're practicing and putting their protocols into use and into treatments of patients, and
seeing these
how to use
improvements
them. Yeah.
every single
Every day, like life-changing improvements. And so we can say that from a practical standpoint, that we see and hear this on a daily basis. And so you can do a survey, and I didn't know that until this year, but it's an incontinence survey. It's actually called the ICIQ, Urinary Incontinence Survey. It's 4 questions. So if your primary care hasn't asked you these, then again, I didn't know about it until the last year. I wasn't taught it in medicine, but it is a 4-question survey that basically asks you practical stuff like, are you peeing on yourself? How often? And so it's a very practical 4-survey question. And basically,
and then it gives us data points.
yeah. So
Where
now you have an
prior
objective
to treatment,
and
and then where you are after.
correct. And that's what they did with this study. So they basically had a score, and it is in between 0 and 24. So the baseline score was 12. So it's midpoint. And it had decreased to 5. So a 7-point improvement.
Which is huge.
Yes. 0 to 24.
And that was 2 treatments.
2 treatments, 4 to 6 weeks apart. 75% had lasting effects at 12 months and 24% at 18 months. So basically 12 months seemed to be like where, again, that was the lasting number. 75% had it, 85% of patients were not disappointed. And again, it was like 97 would repeat. And they weren't unhappy when they had to repeat. So they had 2. And we always recommend, we do it in a series of 3. And again, so we just started to implement this survey specifically to do an observational study because we have not been an office that has really done that. We're taking
No,
other
but what's crazy is
protocols
we
and
do
putting it
with
into
men.
practice.
With men, we have a scoring system,
Yeah, no, correct. But I didn't know one
but we
exists
didn't
for
for
women.
women. So
from
this
that
is
standpoint.
exciting for us to see the actual scoring side of it because we hear it, right? Our patients tell us they love the treatments, they're happy with the results, but now we have that data point too.
We do a lot of testimonials and have women talk about that because you'd rather hear it from them and not us. But what I will say though is, again, we see it objectively quantifying it more, but not only that, we do this every day in practice. So what we haven't done has been a participant office that actually does some observational studies. I have never really wanted to participate in studies. I've wanted to put study information into practice. But now, because there's so few offices doing this, that we have started to quantify this so that we can see what 3 studies do or 3 treatments do, and it's 1 month apart for us. But these are 2 where it said, again, 85% of patients weren't disappointed when the symptoms did come back. 97 were satisfied and 98 would repeat the treatment. And that's huge.
And this is regenerative. So if you got to think, it's not surgery, right? So it's not a go in, cut, sew up, and permanent fix. We're going in, we're heating the tissue, we're telling it it's damaged so that it can repair, so that it can build collagen and elastin. So it is regenerative. There is going to be some maintenance with these lasers. So if maintenance is at a year, that's pretty good.
Yeah, no one and done in life, right?
Well, nothing in life is one and done.
No one and done. But I will say, so like you bring up a key point, which we didn't talk about. So the laser vaginal rejuvenation is telling the body that it's injured to repair, so collagen elastin and support of the urethra, but you get all the other functional improvements. So you get better blood flow and blood vessel regeneration.
Lubrication.
Yes, which is better lubrication. So the
Which
dry,
also-
painful sex is improved.
Exactly.
And then orgasmic strength with better nerve regeneration. And so
Due to blood flow.
yes,
It's all right. It's all about blood flow.
yeah, blood flow and even nerve regeneration with all of these, just because it's regenerative across the board. So not only do you get improvement in just the urinary incontinence, but you also get improvement in all the other things along with it. And so you're regenerating the entire tissue, which is something you are not getting if you put a sling in. And again, the satisfaction rate across the board is not anywhere close to that. You know, it's on a good day like 80%, and that's after all the time commitment that we talked about with surgery. And so, you know, there's, again, you don't get across the board functional improvement in everything, and you don't have the satisfaction rate that you do, and that's with slings.
Where this, in our office, we do a little bit differently than this study, like Dr. Durst mentioned. We're doing 3 treatments versus 2. We're doing them about 4, probably 4 to 6 weeks is pretty accurate. We try to do 4 weeks, but you're coming in, it is regenerative, it is accumulative. You've got to commit to those treatments. That's where we see the best results. And then we tell patients, we'll be repeating this in a year.
Yeah.
Maybe 2 for some.
Yeah.
I mean, some women do extremely well with the treatment. We don't see them for a while, but as we age and we're in perimenopause and then crossing over into menopause, the key, right, the underlying, what's the root of the cause of some of this, right? It's hormonal loss, especially estrogen.
Tissue aging and
Yep, atrophy of the tissue, the changes, right? And then, of course, pregnancies play a huge role in that as well. But when we, in our office, we're addressing the underlying causes as well as treating the tissue. But there is going to be maintenance because our hormones change. The tissue is going to constantly change.
And this study actually points that out, that again, 12 months was pretty much a magic number with these two treatments. But I will also mention that there were very mild, if any, and transient side effects. So there was no long-term side effects. There was no need to remove something. You get functional improvement of everything. We could go on the benefits of a regenerative treatment that is now shown on multiple studies to be safe with very mild and transient side effects. The time commitment significantly different than if you would have surgery. The satisfaction rates are better. You get improvement across the board. And so these are non-traditional. These are fantastic non-traditional options for treating urinary incontinence. And again, this is a female study, and vaginal rejuvenation, non-invasive but also non-ablative erbium, and with great results in stress urinary improvement. Actually, it was mixed stress, so it wasn't just stress, but also, again, just mild side effects. So something to keep in mind.
And if you're looking for this particular laser, it is called Incontinence.
Yes.
I don't know if we mentioned that's the treatment that they did on this.
So the interesting thing about Fotona is the name of the machine. Again, the machine's incredible. The company is great at
The laser's
the
amazing.
It is. And the science behind the laser and all the meetings with the support of the laser company as well. But also they have incontinence, intimolase. They have
Smooth.
it is actually on the outside of Fotona 4D GYN, but and they even have a prolapse lace or something. So just so you know, there's lots of different names that are, maybe
That are out there.
They either are trademarked or trademark pending, but the bottom line is that when we do our treatments, it actually encompasses all of those. And so it doesn't matter if we're not just focusing on the anterior wall for incontinence and everything for intimolase, which is, vaginal functional improvement overall.
Yes.
We are doing that treatment and improves all, and it improves and hits all of those. So, but yeah, because it gets a little complex, and
It
I think
does.
they add.
And patients ask, well, what's that called?
Yes.
What's that treatment called, right? Because we got to get on Google and look it up.
Yes, and we have people come to us looking for one of those particular ones, and we don't have it on the website, and it was like the prolapse one. But again, it is included in all of the ones that we do. It's a complete treatment for functional internal, and then we have an external, which is, again, making vaginas great again, in addition to functional improvement internally, but also externally for a facelift for the vagina. And 4V is what we
The
call it.
laser's amazing.
You
It
need
does
to
it all.
check out that before and after. So those are, again, in office, no pain, no downtime, and the facelift for the vagina. So check out that one as well. So if you've had any vaginal rejuvenation, you've had incontinence treatments with anything else, please leave us some comments. Let us know your feedback, and pass it on to ladies, because
Sharing is caring.
it is in this situation,
Especially in
it
this
definitely
realm.
is, because a lot of women don't know that there's something else that they can do about it. Let us know anything you want to hear about, because we are willing to deep dive into anything wellness or sexual wellness.